The way to think of testosterone is there's actually nothing special about testosterone. It's just one of the androgens that binds the androgen receptor. But it's kind of in that happy medium where it's stronger than some other androgens like DHEA, but it's weaker than some androgens like DHT, to where you can have quite a bit of testosterone and you get like reasonable androgen receptor activation in places that you want it. For example, the brain, the genitourinary system, bone mass, muscle mass, and you get a lot of those benefits without a lot of the detriments that can come from too much androgen receptor activation.
Welcome to the Matt Gray Show. Today we have Kyle Gillett, a dual board certified physician in family medicine and obesity medicine, and an expert in optimizing hormone levels to improve overall health. Welcome to the show, Dr. Kyle Gillett. Good to see you here.
Thank you, Matt. I appreciate it.
I was introduced to Dr. Gillett through Andrew Huberman, a mutual friend. Hormone optimization really changed my life. Around 4 years ago, I found myself depressed, anxious. I had been drinking too much, smoking way too much weed, getting horrible sleep because of those substances. And I realized that I needed to change something, and was feeling super down and out, and went to a doctor, started getting some lab work done, and realized that my testosterone levels were at 200, and for someone my age should have been between 700 and 900. And so quickly started reaching out to experts I know, reached out to Dr. Andrew Huberman. After a few kind of back and forth conversations, was recommended to go to Dr. Gillett. And I can tell you that the blood work and the tests and all the advice I've gotten from Dr. Gillett has truly changed my life. I went from a period of drinking way too much, feeling drained, low energy, low drive, to now being, 2 years sober, and testosterone levels, hormone levels back to where they should be, and more productive, feeling more alive than ever. So first off, just want to thank you for that, Dr. Gillett.
My pleasure. Glad to help.
I guess the first question starting off here is, getting blood work really changed my life. I'm curious, like, who do you recommend blood work for? And what are the main things that you're looking for when you're looking at blood work?
Whenever there's a diagnostic test, whether it's labs, imaging, or other more advanced diagnostic studies, you're looking for something that will inspire a change in management. And this could be lifestyle, for example, diet, exercise, sleep, stress, sunlight, cold and heat exposure, all of the above, hopefully, or medications or supplements, which are basically the same. They both have pharmacodynamic and pharmacokinetic effects. So effects of the medication or supplement on the body and how it's metabolized. So getting a test to where you will not change your management or what you do or what you take is usually not indicated, because it can cause more stress than anything else. So looking for what the goal is, I call it individualized medicine. What is that person's specific goal? And then getting the test that would be most apt to inspire a change in management to improve a health span. Of note, anybody can get labs, even pediatric patients, of course, with the consent of their guardian, can get labs, and these can make a big difference.
Awesome. Now, to kind of dive deeper into that, my real purpose of getting the blood work done initially was because I was worried about where my testosterone levels were at. And after learning more about testosterone and its impact on drive, and the ability to make effort feel good, I knew that if I'm working this hard, putting in this much effort towards my company, I want to make sure that that amount of effort is giving me increased kind of energy, and it feels good. I'm curious, like, what exactly is testosterone in your definition, and how exactly can having optimal testosterone levels help founders?
Testosterone is one of the many androgens that both males and females have. As you mentioned, it certainly helps effort feel good. The way to think of testosterone is there's actually nothing special about testosterone. It's just one of the androgens that binds the androgen receptor. But it's kind of in that happy medium where it's stronger than some other androgens like DHEA, but it's weaker than some androgens like DHT, to where you can have quite a bit of testosterone and you get like reasonable androgen receptor activation in places that you want it. For example, the brain, the genitourinary system, bone mass, muscle mass, and you get a lot of those benefits without a lot of the detriments that can come from too much androgen receptor activation. For example, if you're on a dose of testosterone that's 5 times replacement, there are many health reasons for which this is not sustainable. If it was sustainable, then it would be one of the best, like low risk, high reward nootropics that someone could take. But there's definitely a happy medium. For example, if you're specifically interested in the cognitive benefit of it, if you start at 100 or 200 and then optimize to say 600, that is going to be a much more significant benefit than starting at 600 and taking things to 1,000.
That makes a lot of sense. And so when you're in that sort of like 100 to 200 level range on the testosterone side of things, like what are some of the things you may be experiencing?
Yeah, and this is highly variable. The way to think of it is the hypogonadal or low testosterone symptoms are related to a low amount of gene transcription in the androgen receptor. So the androgen receptor is the only androgen like binding target that all androgens bind to. There is other effects that androgens have as well, but this is by far the main one. It's on the X chromosome. So if you're XY, then you get your androgen receptor from your mother. So you can thank your mother for both your mitochondria and your androgen receptor. It's kind of like Huntington's disease or Fragile X, if people are familiar with that, where you have CAG repeats. Basically, this is 3 different nucleotides that encode for an amino acid. And depending on how many amino acids that encodes from, you can be less sensitive to androgen. Some people may be familiar with androgen insensitivity syndrome. That's where the androgen receptor hardly works at all. So there's kind of a happy medium for androgen receptor sensitivity. If someone has, like, let's say they're having symptoms of low testosterone, you check their testosterone, it's 600. You check their free testosterone, it is 15, which is pretty decent, but they're still having symptoms. Some of that could be related to the sensitivity of the androgen receptor or the density of the androgen receptor. Think of the androgen receptor as a door, and testosterone and DHT are battering rams that are trying to push the door open. If you have a bigger battering ram, then it's going to open that door more easily. And these symptoms come from the opening or lack of opening of the
Hmm.
door.
You know, I found as I kind of started optimizing it and getting it back into levels that were, where they should be, um, experienced just a level of like clarity. I felt my mood on most days has been just like much more consistent. And in addition to that, like the subjective benefit, I feel like, is I've been seeing just, when difficult things come up, whether it's things with relationships, work, whatever, my ability to kind of like power through it and feel like I have the energy, the drive to just move forward in a nice steady state has like increased a lot from where I used to be. It felt very, and it could have been also some of the substance I was on too, but just very sluggish and slow and had a lack of drive. Is that something that, is that some of the subjective stuff you'd hear in someone in low versus high?
That's certainly true. Androgens are certainly dopaminergic, so they can help with motivation and even focus. Having a higher level of testosterone specifically also helps you have a higher level of estrogen and tolerate it without symptoms of high estrogen. So, estrogen, even for males, is particularly important for health reasons. It helps decrease lipoprotein A, it helps with lipoprotein homeostasis. It also helps, just in general, from a variety of different mechanisms, prevent plaque buildup in the coronaries and in the vascular system in general. So, having more testosterone will aromatize to estrogen, and that is also part of what makes that gives you that feeling of well-being. Bodybuilders are familiar with the D-ball feeling. So Dianabol is methyl testosterone, and it does aromatize to methyl estradiol, kind of a cousin of bioidentical estradiol, and it gives this profound feeling of well-being. Kind of all it's in and then it's out, so it doesn't last very long, but you can get the benefit of most of that without the downsides of hepatotoxicity and such by optimizing testosterone and estrogen concurrently.
And so for those that are looking to, get blood work done, what are like, how does that work exactly? I think a lot of people, that are listening to this are maybe looking to figure out their levels and start to optimize a lot of their vitals. I'm curious, like, what are the kind of steps that people need to take to get that done?
There's several ways to get blood work. The 1,000-foot view on blood work is the panel is only as good as who designed the panel. So regardless of if you want to get panels through me or not through me, I posted all of them, I believe, with every biomarker that I recommend for the general population, which is not individualized as well, but I've posted those on my website. But some people do try to run basic labs through insurance. Insurance usually covers things that are not hormones, or they're not specialty labs, or not inflammatory markers, etc. But there's a lot of different like varieties of labs and places where you can get essentially direct to consumer labs that will occasionally have things like health score or age clocks in them. So the way to get labs, if you are going to go through like a traditional insurance system, you would need to have a symptom associated. For example, let's say you're not having extremely cold hands and feet, but they're definitely more cold than they used to be. So you can say, hey, doc, I'm having cold hands, cold feet. Even my hair is falling out more than usual. I'm noticing a bit of a shed. So that should prompt, for example, thyroid hormone testing and ferritin, which is your level of iron in bones and liver.
Okay, love that. Yeah, I don't think many people would have known to go to a doctor and maybe request cold hands, cold feet. So now we know. So in terms of like the best ways to optimize for testosterone, obviously diet, exercise, sleep are sort of like the real, three of the main pillars I think to, be looking into. I'm curious in those three areas, like what are some things that people should be thinking about in order to, really optimize their hormone levels?
When it comes to diet, the Pareto principle is still at play. So the audience might be familiar with the 80-20 rule. If you follow or adhere to a diet about 80%, or sorry, about 20, even the first like 20%, you're going to get 80% of the benefit. So the dietary interventions that I would consider as part of the 20% is eliminating excess liquid calories, eliminating excess ultra processed foods, and then I guess depending on if you tend to run higher on triglycerides or glucose, watching excess calories from fat and excess calories from sugar. So regardless of what diet you choose, and by the way, the best diet is just the diet that you can adhere to for the longest period of time that is relatively healthy. Even if it, like, let's say it's a B plus diet on the grand scheme of things health wise, as long as you can adhere to a B plus, it's better than not being able to adhere to an A plus diet. Exercise wise, zone 2 cardio at least 90 minutes, and that's heart rate between about 110, 140, and then at least one vigorous cardiovascular exercise per week, and then at least 2 days of resistance training. If you're at risk of osteoporosis, if you just like tend to have that run in the family more, you will definitely want to do axial loading, which is basically weight from top down, like squats or deadlifts. Even if they're not heavy, doing a relatively high amount of repetitions can
And
help.
then on the sleep side, what's your recommendation there?
I think you asked, yeah, about sleep. I like the 10-3-2-1-0 rule. So within 10 hours, no caffeine. For individuals who are looking into have more of like a precision medicine approach, testing your metabolism or the pharmacokinetics, that's just how caffeine's metabolized. That's very reasonable. Some people metabolize caffeine very quickly, like myself, and I can get away with even like 8 hours away from sleep taking caffeine. Whereas some people take a very long time to metabolize caffeine, and they should go more like 14 or even 16 hours before sleep. These people are usually ones that know that they don't tolerate caffeine at all, just because they metabolize it very slowly. 3-2-1 would be 3 and 2 hours, no very vigorous exercise. This is like zone 4, zone 5, and then no large meals. And then 1 hour, no bright blue or bright white light. And then zero snooze in the
I've
morning.
heard of a lot, I'm oftentimes trying to find the best way, like when it comes to resistance training to optimize testosterone and what's best for it. I've heard, things like running before you work out is not the right order. You should work, lift and then do your run if you're looking to optimize. I don't know what's true or not here. I'm curious, like, what's the best workout, like resistance training routine for, boosting testosterone, gaining strength?
There, unless there's very, very vigorous exercise and you're at risk of overtraining, running before resistance training is not as bad as you would think it would. So if running is doing, 12 sets of 100-meter zone 5 sprints if you can get into that zone for 5 different times. That would definitely negatively affect resistance training. Um, but if it's just like a zone 2 very slow jog, then that's unlikely to affect the quality of resistance training more than a couple percent. If you're a IFBB pro bodybuilder, then you probably don't need my advice for how to build muscle better, but you're probably also not doing vigorous cardio before your
Okay.
resistance training.
And then the last thing that people always ask on the kind of testosterone side of things is, okay, so, they've optimized their diet, they've dialed in their exercise, they're sleeping well, and they're curious what other sort of supplementation they can be diving into to further optimize those levels. I'm curious your thoughts on things like, Fedosia, and there's a number of others. You've recommended Sigma to me, which I've been taking daily now, and found it's been great. Curious your thoughts on the supplementation side of things.
Yeah, the way that I see this is it's kind of like trying to get into a fraternity. Is you're not just optimizing one thing, so you can't just push your zinc extremely high, or you can't just take mega doses of Tongkat. Um, you're trying to figure out every vector that might be blackballing your testosterone production, and then figure that out. So the first step is it pituitary related or is it gonadal related? And usually a simple LH and FSH test can give you a good idea of that. Past that, you're looking at micronutrients and vitamins. So I think Sigma has, and there's nothing magical about Sigma, it just has ingredients that people tend to find useful. Um, and it has zinc, it has magnesium, I believe it has boron, and I believe it has vitamin D. So those four are arguably the most powerful ingredients in Sigma. If someone happens to have an insufficiency or deficiency in one of those micronutrients or vitamins, that is going to be particularly powerful for testosterone optimization. It also has a form of ashwagandha called sensoril, which is generally pretty well tolerated. It actually kind of helps as a bit of a tonic to Tongkat. Tongkat can be very activating, whereas sensoril ashwagandha is kind of relaxing, a bit like L-theanine. And if you happen to have high cortisol, especially throughout the day, then that can help with testosterone optimization. There's many studies on ashwagandha and the sensoril ashwagandha. There's many different types of ashwagandha. It's a combination of roots, leaves, and I believe stem. And there's Shodan ashwagandha. There's KSM66, but that the sensoril seemed to be the best one to put into a testosterone optimization supplement. Fedosia is a bit more of a niche supplement. Kind of debated whether or not to include it. The upside is that there has been hundreds of years of, I guess, anecdotal evidence in the herbal medicine community. It's from Africa, and it's been used for both libido and fertility. There is preclinical models, which usually means rodent studies, by the way, about both improving testicular health and testicular inflammation and worsening testicular inflammation, but only because of intracellular enzyme upregulation. So that's why for most people on Fedosia, especially a dose over about 200 mgs, 300 mgs a day, especially if they're taking it consistently, I check alkaline phosphatase and GGT because those two in preclinical models have always been elevated when there is a degree of testicular toxicity. The other nice thing about it is that it works, and it is very common to see LH. It helps release LH and helps the LH receptor, which is what produces testosterone. I have seen this on hundreds of labs, so that's probably the best thing about it. If I had not seen that, then I would not recommend it, and I probably wouldn't use it either. But that's the nice thing about it. The alternative, in some cases, it's not a true alternative to TRT, but it's nice because if your LH has been suboptimal for quite a long time and it's been high ones or low twos, then you use this to think of your testes as a manufacturing plant. You turn the manufacturing plant back on high, and then you let it go and see what happens. So it's not necessarily something that needs to be taken permanently, and neither is it an alternative for PCT, for those wondering, which is post-cycle therapy after a steroid cycle. But it does have applicability, and it does seem to be relatively well tolerated. You compare it to something like rhodiola rosea, which I'm not against, but it's a bit of a shotgun of a supplement, if you will, because it has so many proposed mechanisms and a lot of people use it, but it it doesn't have a known or characterized mechanism of action. And I am a fan of mechanism of action, and I think at least for Fedosia, that is very
That's a great
apparent.
breakdown. I appreciate the deep dive. And
For sure. One other note I guess we should mention about Tomcat is Tomcat is a much better or potentially more efficacious supplement in those that have very low starting insulins and IGF 1s. So if you're perhaps like low carb or keto, or you just have very good insulin sensitivity, insulin and IGF 1 upregulate three different steroidogenesis cascade enzymes. These are the same enzymes that Tomcat works on. So if you have a fasting insulin of 20, which is quite high, then Tomcat is probably not going to work as well. If you're on something like ibutamorin, which is MK677, or any growth hormone peptide, those can actually improve testicular function as well, kind of in a similar way to Tomcat. Tomcat will also improve adrenal function. Steroidogenesis cascades are pretty similar in the zona reticulosa, which is the area of the adrenal gland that produces androgens. So it could also increase DHEA. If your baseline DHEA sulfate is already high, you might be what I call a hyper responder to Tomcat. There's actually several different like mechanisms in Tomcat. I'm specifically talking about the uricominones. So the uricominones can be anywhere from like 1.5% to 25%, depending on what standardization it is. So looking at that would be the main like direct steroidogenesis cascade mechanism of action. I think that one of the other glycosaponins, which is basically like about twice as much as there is uricominones, you have other pharmacodynamically active compounds. I think that one of the other ones in it is a stimulant.
that's really interesting. To kind of switch gears here, um, I, talk to founders every week that come to me looking for advice. They're running a business that's running them into the ground, and they've gotten to a stage where they're just incredibly burnt out. Their mood is incredibly low. Oftentimes they're depressed, they're feeling anxious, they feel lost, and they're not sure where to go. And the one thing that I'm able to help with is a lot of like the systems to make building a business much more sustainable, to allow you to work on your business, not in your business, and start to free up your time. So you're able to kind of have more clarity in terms of how you're going to accomplish your vision. And that's kind of what we dive into a lot in Founder OS. I'm curious more on your side of things. A founder comes into your office, they're feeling incredibly burnt out. What's kind of like your approach to helping someone with those sort of like emotional and even sometimes physical symptoms?
I have what I call a holistic approach, and really that just means not just approaching the individual from a physical standpoint. So some people call it body, mind, soul. Soul really just stands for your metaphysical needs. What like on Maslow's hierarchy of needs, there's a pyramid, and at the top is self-actualization. What your purpose in life is, or what you assess your purpose in life to be, and beyond your physical needs, what your main goals are. So presumably for founders, this self-actualization need is probably tangentially at least related to the business, if not integrally. But kind of just like refocusing on that and then incorporating mental health, physical health, the lifestyle pillars that we mentioned, and then also look at objective markers. So there's the subjective of how they're feeling and how they're doing, and then you match that with the objective. Um, what does imaging look like if they need it? What do labs look like if they need it? But oftentimes, an interdisciplinary team is a better way to approach things. So, I work with dietitians, I work with chiropractors, work with people across the entire spectrum of the interdisciplinary team. So, having many minds figure out solutions and stepwise ways to improve that burnout is good. Burnout is very common in medicine as well for a multitude of reasons, but a lot of the you mentioned this too. A lot of the problem is that even among founders or the people who are a stakeholder with a lot of power. If you did a stakeholder analysis in the enterprise, they still don't have as much power as like ability to change things as they should, considering how much they put into the business. So when a healthcare provider works for a huge health system, it might be similar to, for example, a founder that has investors or has a board that they're kind of like
Yep.
grinding against all the time. Whenever someone goes and they request something and then it gets denied, and you request something and it gets denied, and it requests something and it gets denied. And this is one of the reasons why I left the traditional healthcare system, is because at the end of the day, the modern insurance-based healthcare system is not good for patients and not good for providers. The only people it's good for is the investor in the company that owns the huge hospital chain. And that being said, I still take all insurance as I'm just out of network for all of them, because I won't accept any of the bribes. I mean, the in network, like exclusivity projects that there is. But I assume it's quite similar in the founder sphere.
Now, a hot topic with founders is always trying to figure out how do we get into that like deep work state. And for me, my typical day is I wake up, go for a run, meditate, you know, water, vitamins, all that good stuff, and then I kind of try to block off from like 7 generally till 11 a.m. No meetings, to just get rid of my phone, no distractions, and go deep. Um, Here and there, if I'm on more of you know a grind on some projects, every here there, every couple of months, I'll experiment with things like alpha GPC or alpha brain from the folks at On It. I'm curious, how do you look at that kind of realm of focus and helping founders maybe dial that in? How do you look at that?
Yeah, I think I look at it relatively similarly to many other physicians, especially during medical school and residency. I'm a lifelong learner, of course, so I've learned much more after medical school and after residency. Um, and it's not always that way for physicians, but there's a plenty of lifelong learners out there. But all that preface to say, yes, my lifestyle habits are very similar to yours. I exercise in the morning, and then from 6 or 7 until 11 or so, try to get into that in the zone state where I'm doing the tasks that require the most focus, concentration, and stick to itiveness, if you will. And then after I eat lunch, then that way I don't have to be as creative. I don't have to be as focused. So there's a different task list kind of set into the afternoon part of the day. And that doesn't necessarily have to work for every individual, but that's something that has worked well for me as well. On the tangent of basically like cognitive performance optimization, it's kind of similar to athletic performance optimization. You think about top level athletes, almost all of them are on performance enhancing substances, whether they are supplements or whether they are medications. People know how we look at supplements and medications. Again, they both have pharmacodynamic and pharmacokinetic effects. The only difference is that one is prescribed and one is not. There are natural medications, there are synthetic supplements. For example, like what's more natural, a bromantane supplement that is completely synthetic, even though it's dopaminergic, that's a synthetic supplement, or a prescription of, say, Lovaza, which is omega 3s, like isolated omega 3s. So and that's the tangent about like medications and supplements. Personally, as you mentioned, I like alpha GPC and tyrosine a lot. My friend James O'Hara, my co-podcast host, I think he calls that the entrepreneur, like billionaire nootropic stacks. Like a little bit of caffeine in the morning if you can tolerate it, maybe with aspirin, because that can kind of potentiate the effects. Again, if you can tolerate it. And then, like 2 grams of L-tyrosine, which is a big dose, plus 400 mgs of alpha GPC. That's kind of like a bare bones nootropic regimen. That being said, I love medications as well. I have a bit of hypersomnolence. I, of course, used to deliver babies until a month or two ago. So there's some shift work sleep disorder. So yes, I've certainly been had the benefit of utilizing things like modafinil, which is basically keeps you awake, but it can also be histaminergic, so it's not without side effects. And there's many other prescription medications. There's a few that have recent evidence to help, even at very low doses that are off-label for other conditions. For example, roflumilast at a very low dose is potentially very beneficial for memory tasks. There's pretty good clinical trials on that. So there's a lot in the sphere of cognitive performance enhancing compounds.
I can just hear people just rushing to go get this billionaire entrepreneur stack as we speak. I'm curious, actually, off the modafinil side of things. Modafinil is something that here and there, very rarely, but every now and then will experiment with. If I'm working on, say, just a bunch of like maybe writing I need to get done over a 4-day period to develop a new book or whatever I'm creating. I'm curious, the one thing that I've experienced with any of those kind of things that get like on the stronger nootropic side is like a bit of a dip the day after. I imagine it. I don't know. If I'm a betting man, it has maybe something to do with that, the dopamine pool you talk about. That maybe, I don't know if it's spiking my dopamine while I'm on it, and then I experience a low after. But I'm no expert here. I'm curious, like when I experience those lows after, what's causing that, and how do you prevent that if you're using something like a modafinil?
Yeah, there's a couple of reasons. And a lot of people at the 200 mg dose have the dip the day after the day after. So not directly the day after. So a lot of that's probably
Mm.
related to sleep quality after. And a part of it might be dopamine, not, but modafinil has kind of an indirect mechanism of action. So it very likely is dopaminergic to some degree, but not extremely. It's also certainly orexigenic. So you have your orexin and anorexin. Your orexigenic center of the hypothalamus is hungry, angry, and awake. Some people call it hangry. And then anorexigenic center is exactly what it sounds like. So part of that might be like as the modafinil is wearing off, you're not as focused, so you eat a ton later that evening or even the next morning. And then part of it is that it can be histaminergic. So some people that are more sensitive to histamine can kind of have that itchy reaction. The skin just kind of feels warm. I have pretty bad allergies as well. So if you take it in the spring, then a lot of people notice almost kind of like an allergic response. That's why I take it with quercetin. Quercetin's interesting because sometimes you want to have quercetin absorbed and bioavailable, sometimes not. But if you take like a highly bioavailable quercetin with your modafinil, for example, 500 mgs of quercetin with 50 to 100 mgs of modafinil that your doctor prescribes, then it can kind of like attenuate that histamine response. Histamine has three main receptors. So, for example, Zyrtec is a histamine 1, Pepcid is a histamine 2. They both block histamine. Wakix, which is another interesting one, pitolisant, which is actually a non-controlled modafinil alternative. That's a direct histamine 3 receptor activator or agonist. Modafinil likely activates all of these. Benadryl inactivates all of these. So just how people kind of feel a bit hungover after they take Benadryl, when you take modafinil, it kind of depletes the histamine release from the mast cells. Mast cells also have serotonin receptors. So you have kind of a down regulation in both serotonin and then a depletion in histamine as you get that modafinil withdrawal. That's why it feels so much different than withdrawal from, say, like a Vyvanse or Dexedrine or very dopaminergic substance.
Awesome. No, I appreciate that deep dive in. Yeah, no, it's interesting. I'm going to take a deeper look. I have to re-listen to this to use some of those tips. I've been more open about my sort of journey to sobriety over the last few years, and anytime I'm sort of sharing that, whether it's with my community or with different founders, I always get people kind of hitting me up saying, either I'm struggling right now, or this is something I've been putting off for years, and I feel like your message has given me the prompt to pursue this avenue again and recommit. I'm curious, when someone's kind of looking to sober up, whether it's on alcohol, cannabis, or another substance, how do you kind of like embark on that journey with them?
Yeah, the first part of that is both shared decision making and patient centered medicine. So one of the terms that academic centers use, the term doesn't matter, but it's called active listening. So as a physician, then I want to listen and assess what stage of acceptance the patient's in. There's kind of like this is very standardized for nicotine cessation, but for nicotine cessation, the average amount of times that sobriety or cessation is attempted before it's successful is 11 times. So part of it is
Wow.
just having a conversation, both as a friend and a healthcare provider, that like multiple attempts before sustained sobriety is normal and expected. So that's part of it. The second thing is obviously being non-judgmental. So whether it's for performance enhancing drug use like anabolic steroids, whether it's nicotine, whether it's regardless of whatever it is, just having an understanding that should be viewed as a good thing, kind of similar in obesity medicine with weight loss attempts as well. So that's definitely a way to approach it. And then the third way is looking at the difference between a tool and a crutch. So some people, regardless of what like sobriety they're attempting, even if it's weight loss, they do not want any help, whether it's supplements or medications. And just having a conversation, and if that's the case, then obviously that's completely up to them. But discussing realistically what can help and what will not be needed to help, and also when to expect to come off of that. So an example for alcohol would be talking about like a naltrexone or even a low dose naltrexone in order to kind of like help transition during that period. Might even help, for example, explain the niche benefits. It might help with LH and FSH release, and it might help improve testosterone during an attempt of sobriety. So having conversations like that, I think, is really important to just be very candid.
That's awesome. Many people that have get to know me on a deeper level are surprised to learn that over the last 3 years, I haven't consumed any cannabis. And they're curious, like, how is that? Like, you run this cannabis community of 14 million people. You have built that over the last 9 years, and you're telling me you don't consume cannabis? Like, well, what's going on, guy? And my reason for actually cutting it out was when I learned about the effects of cannabis on testosterone. And I was looking to optimize those levels, dial them in, and realize that cannabis breaks the chain from DHEA being converted into testosterone. I'm curious from your standpoint, what's your like overall kind of perspective on cannabis as it pertains to vitality, to things like sleep and hormone levels?
Yeah, it's very interesting from a variety of different standpoints. Obviously, the body has endocannabinoid receptors, so we do have receptors for it. That's mostly how it works, and it also has hormonal effects. They are like a little bit difficult to categorize just because a lot of the studies on its hormonal effects have been done on smoked cannabis. And for smoked cannabis, we know there is a much higher spike in prolactin, for example, but perhaps that's mostly the smoke and not the cannabis itself. Because when it's the studies that you can find on non smoked cannabis, for example, edible, do not have nearly as strong as an effect, especially compared to things like kratom or mu opioid receptor agonists. So, yes, and you mentioned the effect on the steroidogenesis cascade enzymes. Those are dose dependent. So, at higher levels, that can certainly make a difference. And then you noted its effect on sleep. There's actually a supplement. It's called PEA, polyethylenamide. I might have said that a little bit wrong, but anyway, PEA is a fatty acid that also binds the endocannabinoid receptor that is occasionally helpful for sleep. Every once in a while, I will have someone take it and they'll say it like knocks them out, almost like a tranquilizer, but they're not hungover after their sleep. So it's a highly varied response. It is an interesting compound to use to get some of the sleep benefits for like in lieu of cannabinoids after sobriety.
Oh, wow. That's really interesting. Yeah, I know, because I know there's an interesting experience when you quit cannabis. You suddenly start to find, your dreams coming back. I found when I was consuming cannabis, I never dreamt, or it was very rare.
Yep.
And yeah, that ability to kind of fall back to sleep can kind of get a little wonky for a bit. So you're saying PEA can be something that's useful for that, right?
Yes. Yeah. And
Huh.
um, there's lots of rabbit holes that we could go down. For example, people that self-medicate rather than using like a prazosin for dreams and nightmares, they utilize cannabinoids. Um, but yeah, occasionally PEA is helpful. Um, some pharmacies sell a prescribed version, like it's a medication of PEA with different types of collagen as well. So the different types of collagen wouldn't be as helpful, but PEA is an anti-inflammatory. So some people with joint aches or whatnot that were previously, maybe they're using CBD for that, also get that combination of PEA with advanced collagen.
To switch gears here, I'm curious. It's interesting with so many things when it comes to diet. You think you're making the right approach, and then you talk to another school of thought or a different person, and they're like, "Oh, definitely don't do that." And something that's I've been hearing recently is like, I've been really big on intermittent fasting. We'll generally fast around noon, 2 p.m., depending on how I'm feeling, and drink a coffee in the morning. And I've heard kind of recently from other schools of thought that this idea of like drinking coffee without any food in your system, without any fats, is going to really raise your cortisol levels and isn't healthy. I'm curious, like, where do you stand on intermittent fasting? And further to that, like, what are some things that people can be doing to kind of manage their cortisol levels, especially, entrepreneurs that are busy as hell, dealing with a lot of stress? Like, what are some strategies there?
Yeah, and it is a great question. Good rule of thumb: wait 60 minutes before drinking coffee in the morning. 60 minutes after you wake up. So if you hit snooze at 5 a.m., by the time you get up at 6, it's probably actually okay to start drinking coffee. But that kind of goes back to that trying not to hit snooze in the morning. But yeah, as far as controlling cortisol, a lot of people who have had a high cortisol for a long period of time, especially if they have low ACTH. ACTH is a hormone your brain sends to your adrenal gland to produce both cortisol and DHEA. Interestingly, it produces it increases synthesis of a glucocorticoid, which is cortisol, and an androgen, which is DHEA. But if your cortisol tone is low or you have burnout, again, that's not a medical term, but you see it anecdotally. Someone who have been stressed founding their company for many years actually has too low of cortisol. So for that person, um, a cup of coffee on an empty stomach might be a great way to improve cortisol. However, that being said, it's not uncommon to see early morning cortisols of like 25 or 30. Those individuals should certainly not be trying to spike their cortisol with caffeine. Caffeine and coffee in general is not necessarily like uh, good for like it's not going to affect your testosterone. So if people ask that like what's its effect on hormones, it's not going to skew your like testosterone or estrogen significantly one way, but it is going to kind of shift that natural up and down of cortisol and potentially melatonin as well, depending on how it affects your sleep. So it can help kind of restructure your day. So it is particularly useful for things like jet lag. But yeah, at the end of the day, it's kind of an individualized regimen for the average person who doesn't want to get their cortisol or their labs done. Then just waiting 60 minutes to drink coffee in the morning and trying not to drink more than 1 cup on an empty stomach is a safe, happy medium.
When it comes to, we've talked a lot about sleep here, and no screens 10 hours, or no screens a few hours before bed, no caffeine 10 hours ideally. What's your kind of like, it's 7 p.m. as we're approaching, going to sleep. What's kind of like your routine there? What's like the sleep stack that you'd recommend? And obviously it's dependent on the person.
Yeah, so around 7 p.m., I'm putting my 2 young boys to bed. So, depending on the pandemonium that ensues during that, or depending on how many breakdowns or fits that the boys have, that kind of like uh, sets the structure for what I'm doing the rest of the day. Occasionally, I'll have a troche of L-theanine, sometimes a little bit of GABA in the troche as well. Um, and in addition to that, occasionally, I will take I have familial hypercholesterolemia, so I take a statin 3 nights a week, less myalgias and just as much efficacy. So I usually take that since it's the evening as well. And then I usually take inositol. So inositol is like vitamin B8. It's a supplement that can concentrate in the CNS, basically in the brain, and it can help with sleep and relaxation. Occasionally, I will also take apigenin 9 glycoside, which is isovitexin, my favorite apigenin. And that is very dopaminergic. It's a monoamine oxidase inhibitor. It's going to help me have a bit better REM sleep. So if I think that my REM sleep and like restfulness the next day is going to be terrible, then I can take that. It does not stimulate me too bad. Some people feel stimulated from it, but that's my general sleep stack. Occasionally, I will take 1 or 2 milligrams of melatonin to sleep. I metabolize that fairly fast as well, and I usually take that about an hour before I plan to go to bed. I usually sleep at about 8:30 or 9 and get up around 4 to 4:30.
Okay, amazing. Love the approach there. In terms of the subject of sort of like libido, I know after getting some of my blood work done, I was surprised, and it's interesting these tests because you're testing so many things, most of which I find I've never even heard of, and my prolactin levels were apparently higher than they should be, which can affect libido and some other things, and so was kind of recommended to go on to vitamin E, vitamin B, and it's had a significant improvement there and back to kind of like normal levels. I'm curious, like your kind of approach to like the subject of libido in men and how to kind of optimize that.
Yeah, libido definitely has multiple inputs. I like to look at the ratio of androgen to estrogen, for example, testosterone and DHT to estradiol. I like to look at prolactin. I like to assess dopaminergic to serotonergic balance. Very hard to measure that. Progestogens can matter, so like pregnenolone, progesterone, but not as much as androgen to estrogen, especially in men, probably more so in females. But the dopaminergic to serotonergic balance is particularly important. Estrogen is more related to serotonin and like myelinization of nerves. Estrogen is also related to like fluid and blood flow. A lot of people know that when you're pregnant, you get water around your ankles. If you're a male and you have very low estrogen, like for example, especially if you're on an estradiol or an aromatase inhibitor and have low estradiol, then you're not going to have good fluid flow even in genital tissue. My friend Derek, he has the YouTube channel More Plates, More Dates. He mentioned that like on an aromatase inhibitor, your penile tissue can become like a flap of skin for no other purpose than urination. So you definitely don't want too low of estrogen, and you also don't want too high of estrogen. Too high of estrogen, then a lot of times you have relatively easy fluid and flow, but you just tend to lose it because your androgen to estrogen ratio is off. So you look at all those things and try to balance it and know that none of them will really be perfect 100% of the time. But keeping in mind that all of those balances are important. You don't want too low of serotonin either. So I guess that's, for a lot of males, that's the good 1,000-foot view. Lower estrogen is not necessarily better, and lower serotonin is not necessarily better. One of the main treatments for premature ejaculation is an SSRI, duloxetine in other countries. Occasionally a low dose of fluvoxamine here because it's kind of like the next best alternative. But yeah, I guess it's a balance where you're on a teeter totter and one foot is on one side and the other foot's on the other.
Yeah, it's a good way of putting it. In terms of last question here, I'm curious. You're kind of like you said, a lifelong student. You went through the kind of normal education system to become a doctor, but since then you've become very similar, I think, to Andrew Huberman. Just continuing to kind of up level and push the needle forward in your path. I'm curious. Out of all the different kind of medical developments you're seeing out there, what has you most excited about the future?
Um, I guess it depends on which sphere. In the field of obesity medicine, I am particularly excited that we are basically innovating our way out of poor lifestyle, which I don't like. It's a love hate thing. So obviously, you still want to emphasize the lifestyle, and you can help a lot of people with this, but our tools are better. So for these people that are caught in the quicksand, we have better shovels, we have better backhoes. So we just have a lot of other options. For example, there's a monoclonal antibody that works downstream to myostatin that looks like it's going to eventually be transferred over into the obesity medicine sphere. And then, of course, there's a lot of new incretins, which are kind of like the newer, better versions of GLP-1 agonists like semaglutide. So basically, there's going to be a lot of tools to help people. I'm not against technology. The reason why we have so many billions of people on the earth is because our artificial carrying capacity is artificially inflated with technology. So that appears to be happening in medicine at fairly high levels. I am both concerned but excited about the advances in, I guess, hormone therapy when it comes to um, mostly estrogens and progestogens. I am kind of sad that we're missing 50 years of data on androgens that could be helping people. But more on that in the podcast that is being released on oral contraceptives, which is basically synthetic hormone replacement therapy that James and I just filmed. But there's a lot of interesting developments and new molecules now that are going to help many people that have hormone dysfunction.
And so do you see a world where like in the, coming future that people that, are struggling with obesity, like they simply just could take some sort of, medication and basically kind of conquer that? It becomes a lot more optional, or how does that work?
The way I see it is that it's just literally a better tool. So if there's someone stuck in quicksand, you shouldn't just throw a shovel at them and um, just say, use the shovel. You should teach them how to dig out of the quicksand and get out of the situation of metabolic syndrome and obesity. But at the same time, if you've tried teaching them how to get out 24 different times, they want to get out. As technology gets better, we have the backhoe of semaglutide now, but eventually I think we'll have a crane where we can just pick someone up and put them on the side. Maybe they will walk straight back to that pit, but I do think that it is ethical as long as they understand the risks of being like pulled out of that quicksand and put on the side. It would be nice to be able to do that without requiring a surgery. So we do plenty of bariatric surgery. If there is a pharmacotherapy option that had kind of similar benefit, I think that it would be ethical to utilize from time to time. And I think it would also greatly lessen the burden on the healthcare system and lower health insurance costs as well.
Okay, that's amazing. And last question here: if founders are, that are listening to this, if they're looking to, for that kind of 20% of things that are going to provide 80% of the benefit, where's like the first place they should be starting, from your perspective?
Definitely the lifestyle pillars. So I like to say those things that are lifestyle interventions are more powerful than any medication or supplement, and that's certainly true. I talk a lot about this on my podcast, and I guess my Instagram is a good place to go. It's Kyle Gillett MD. I like to give people the tools to develop a balanced approach to health. Each individual has different goals, so figuring out what you can do and what you cannot do, and what the upside and downside of that is very important. It's not all about being 100% optimal. We don't all have to spend, half of our fortune and 8 hours a day being a biohacker. So the first 1 hour a day of those interventions is going to give you most of that benefit.
Awesome. Well, this has been amazing. I've learned a ton. For those that are interested in learning more from Dr. Gillett, be sure to check out the links in the description below to his podcast as well as his Instagram. And for those looking for more systems to kind of get off the hamster wheel of their business and be able to focus more on their business versus being in it, be sure to check out the Founder West newsletter below. Thank you so much for your time here, Dr. Gillett, and hope you have a beautiful weekend.